So a number of studies have shown that inherited variance increases your risk of CLL. And so through these genome-wide association studies, which is a very successful study design to identify these inherited variants to be associated with risk of CLL. And what these study designs do is that they have a group of CLL patients and a group of controls, and we genotype over 5 million markers across the genome, and we evaluate each marker to see if it's associated with the risk of getting CLL. And because we're doing a large number of tests, we have very stringent thresholds for what we call statistically significant to be associated with risk of CLL. And so to date, there have been 42 inherited variants that have been identified to be associated with the risk of CLL. And these inherited variants have been validated through many studies now. So they're robust markers. And we're finding that these inherited variants seem to be in regions that regulate gene expression, but there's still more that needs to be identified about how they actually increase, what's the biological mechanism of how they increase your risk of getting CLL. But each of these individual markers have a small effect on your risk of getting CLL. Its effect size of about 1.1, 1.2. And so each one by themselves do not really have a strong effect of your disease risk. So what we have subsequently done is that we've combined these genetic markers into a score, a polygenic risk score. And we're finding that this polygenic risk score is also a robust marker, like a biomarker for risk of predicting if someone's going to get CLL. And so we're finding that individuals who have a large number of these inherited variants have a 3 to 5-fold increased risk of getting CLL. And if you don't have very many of these variants, you have a low risk of getting CLL. In fact, it's protective. And so this distribution of this risk score really does help you stratify who's at risk of getting CLL. The other aspect is that the family history. So if you have a family history of leukemia or lymphoma, you also have an increased risk of getting CLL. But if we combine the inherited markers plus the family history status, we find that we have an even more informative information about someone's risk of getting CLL. So individuals who are have a large number of these inherited variants plus a family history of getting CLL have a 5 to 7-fold increased risk of getting CLL. And so this information can help determine someone's risk of getting CLL. Lastly, individuals who have been screened for the precursor condition to CLL, that's called monoclonal B-cell lymphocytosis, or MBL. So individuals who are found to have MBL also can use this polygenic risk score, this risk score model, to help determine maybe their risk of progressing to CLL, because not everybody with MBL progresses to having CLL.